Very much. Senator Booker.
Thank you to the chairwoman and the ranking member. I want to highlight something about SNAP eligibility, an issue that's a little broader. We've addressed it in other of my committees. But during the 1990s, we had this very big war on drugs that caused a lot of harm to people who have paid their debt and have re-entered society. On the Small Business Committee, in a bipartisan way, we said that those folks who are entrepreneurs should not be ineligible for SBA programs. In a bipartisan way, in the Judiciary Committee, we addressed other eligibilities for people who had paid their debt to society. However, right now, still, we have a ban on people who have drug crimes and have paid their debt, have served their time. They still cannot receive SNAP benefits. Hunger and food insecurity are significant challenges that formerly incarcerated individuals face after release. The SNAP ban is not just one obstacle that diminishes their prospects of having a good life, but it actually increases the chance that they will recidivate. It's us being penny wise and pound foolish. Individuals face already challenges who have been formerly incarcerated in housing, employment, health care. But to exclude them from programs like SNAP actually compounds their difficulties and, again, increases that risk of recidivism. It's my hope that we can come together, as we have on other committees, in a bipartisan way and fix this mistake. I request the unanimous consent to put into the record this letter from a long list of groups, nonpartisan, bipartisan, groups from multiple states represented by people on this committee asking for us to correct this mistake and actually save taxpayers money by reducing recidivism.
So ordered without objection.
Thank you very much. Ms. Dean, I want to thank you for being here, and I want to let you know that I think we're in the midst of one of the greatest nutrition crises our country has ever seen. Right now, half of our population in America is diabetic or pre-diabetic. Every month in the United States of America, diabetes causes 13,000 new amputations, 5,000 new cases of kidney failure, 2,000 cases of blindness every month in America. And it's not something that's just affecting older people. It's stunning to me that we now have 25% of our teenagers are pre-diabetic or have type 2 diabetes. My colleague, Joni Ernst, mentioned the profound reality that 77% of young people ages 17 to 24 are ineligible even to serve in the military. Much of this can be attributed to the alarming fact that ultra-processed foods now comprise 2/3 of the calories that children and teens eat. And so in this Farm Bill, I believe it's imperative that we scale up the nutrition programs that we know are working, that are evidence-based, that are making a difference to people's health and well-being. We know that we can do better. We have clear evidence to that fact. One program I know that is working and we need to scale up is the GusNIP program. While we know that this program provides life-changing benefits, I've seen it myself in communities, helping people get off their prescription drugs, which cost taxpayers often money, helping people improve their lifestyle and their well-being. This program is a powerful incentive and benefit for farmers. We know that it will help those farmers who are growing fruits and vegetables for the local community. So can you please talk about that aspect, how this is a pro-farmer helping folks, how this pro-farmer program GusNIP helps folks?
Thank you, Senator. I'm happy to do that. And first, let me say the administration supports the repeal of the ban on ex-offenders with a drug conviction. So thank you for lifting that important issue. With respect to GusNIP, it gives me the opportunity to underscore our approach on nutrition security, which really has four components: making sure that our benefits are meaningful, increasing access to healthy food, collaboration with thousands of partners across the country to promote better health and nutrition, and integrating equity across all of those pillars. And GusNIP does exactly all of that, in addition to building stronger connections between our federal nutrition programs and local producers and local markets. So I appreciate that's quite a tee-up you gave me there. GusNIP is a essentially the way it works, and the chair flagged it in the NEAM in Michigan, it's double up bucks is one of the most popular forms where a SNAP participant would go to a farmer's market, say, here's $20 in my SNAP benefits, and receive $40 in tokens.
But if you could,
That goes
in the
directly
seconds I've left,
into farmers' pockets.
that's what yes. So it really is how you're seeing it fundamentally empower our local farmers.
And increase fruit and vegetable intake, yes.
And increase fruits and vegetables intake. I really appreciate that. I've got another question I'm going to put into the record about how SNAP Ed can be redesigned so that it can start to reach more of the 90 million low-income Americans that we need to reach, and I'm hoping I can get that for the record.
Terrific, and we share that goal.
Thank you so much. Thank you, Madam Chair.
Thank you very much. Senator Thune, you always manage to time it right when it's your turn to ask questions.